in and around 40 years or more, really, and been a strong advocate and done a lot of different things in independent living for all of those years. So she's had many roles and awards and honors. She served as the president of NICL, or the National Council for Independent Living Board, and was appointed by President Clinton, confirmed by the US Senate to serve on the National Council on Disability. She started the SILC in Kansas, this statewide independent living council, and was the first person of the Kansas Association of Centers for Independent Living, or CASEL. She worked for Social and Rehabilitation Services, SRS, or now the Department for Children and Families, or DCF, however you know it. She helped to launch the Home and Community-Based Service Waiver Program, and was the first ever self-directed head injury waiver program. She currently serves on Independent Connections Board and has for many, many years. In fact, she started the center here in Salina. And like I said earlier, she has over 40 years of experience, most of which is in independent living. And she holds a master's degree in rehabilitation and administration. And that's just the main highlights, but there's lots.
That's boring. Yeah.
The boring stuff, right?
Yeah.
Thank you for joining us.
Yeah. Well, thanks for having me. This is fun. It's great to see everybody again. And I'm gonna do this as well as I can, because I usually roam all over the room, so be patient with me. Welcome and thank you all for coming. Sometime this morning, we're going to take a break to let you scooch around and everything. If you haven't seen the drawing over here, you should, if it's not raining, you should get a chance to go out and see it. It's beautiful. We had an artist come in and do some research in the city and found the picture of some kids and drew it up there, and I think it's amazing. So really proud of that. So everybody ready to go? We're have some folks. I appreciate you guys coming on the Zoom call too, and we will do our best to attend to you and holler at me if I'm not taking time to stop for questions or anything. We're going to talk about the history and philosophy of independent living, and I hope we can make it a little less boring than what it sounds like. There's lots of stories I could tell you. There's lots of things we could talk about in a break. If you want to have those conversations, we sure can, but we're going to kind of try and stick to the facts today. And then I'm going to put you to work a lot of the time and ask you some questions about how all this fits for what you're trying to do, and how does what we learned before have an impact on what we know today. This past 3 nights, I've been watching Ken Burns did a film on the Holocaust, and it was just hard and immense and incredible. But the really important thing about it is that we remember, and that we remember what was happening and what was going on. And each time as we go through, we learn a little bit more, and it helps us to move forward with how do we behave today, or what do we do to change the world today so that that never happens again. And that's a lot of what the independent living philosophy and background is all about, is to give you a background so that we learn from it. We don't necessarily do everything they did then, because a lot of the time when they first got together, people with disabilities kind of get together, were smoking pot and talking about how awful the world was. Nobody had any rights or anything. So the movement really began in some cases in a really immature and kind of mixed up way, but we moved forward. And so what did we learn from it? And then how do we learn from what we're doing now? Sometime during the training too, we're going to do a brag and steal. Everybody know what a brag and steal is? Anybody? Okay. You brag about things that you do well, either at the center or the office, or, or with consumers that you're working with. And then you steal other people's ideas. So we all get a chance to benefit from what each other knows. Okay. And I hope you all take advantage of that, because that's going to be one of the times I'm going to ask you to get together. So history and philosophy of independent living. The first thing I want to talk to you about is the social movements that affected independent living. Things like the civil rights movement. For many of you in the room, you don't remember that, but you probably read about it. But there was a lot of civil rights protests going on with African Americans, with people, with women, the beginnings of all those things. And what was the point of that? What were they trying to achieve? What were they trying to achieve then, and what are we still trying to achieve now? Equality. Is to have equality. And people got together and worked together as a group to say, we want equality. We want the same rights that everybody else has. And during the 60s, that was happening really big time. The second thing that was going on was consumerism. Consumerism was started out with a guy named Ralph Nader, who decided to let everybody know what was going on so that you just didn't go into a store and buy whatever the guy who was the best talker had to say. You did some research and you found out what the quality of the product was. Consumerism is having a little more control over what you decide you're going to get, what you decide you're going to purchase, what you decide you're going to buy. When you buy a car these days, if you just walk into a car dealership, what are you going to get? Most expensive item on the lot. If you don't do your research ahead of time, you're gonna be in trouble. So it's finding out all that information, and we got a whole lot better as consumers, as people who use products. We got a whole lot better at figuring out how to do that. Self-help was another big hot issue in the 60s and 70s. They had whole sections of self-help books that taught you about, hey, you can do everything yourself. And today, everybody does anytime I need something done in my house anymore. Later on, I wind up calling the plumber, but I have to start with YouTube University to figure it out for myself and try it. And I've gotten a lot of things done. But that self-help concept of I can take care of my own self, I can take care of my own needs. I may need some information on how to do it, but I can figure it out. So that concept, those concepts were big concepts that influenced the disability rights movement. And then the last and the biggest one was deinstitutionalization. Deinstitutionalization was happening all over the country. Where did it start? Anybody know?
Denver?
Sorry.
Was it Denver?
Well, actually, the disability rights movement, a lot of it started in Denver. That's a good point. But really, even before that, people with mental illness getting out of institutions and moving back into communities. Now, was that because people in communities said, oh, people with mental illness shouldn't be stuck in those institutions. They should be able to benefit from services in the community. Is that what happened? Hell no. That's not what happened. They were saving money. So they closed down the institutions and they sent people out into communities. I don't know if that happened in Kansas. I grew up on Long Island. And when I was a little kid, it was impossible to go downtown without seeing somebody who was mentally ill hanging out in the street. And it was usually like a really cheap hotel where they stayed at, and then they begged for money, or they wound up in jail, and those kinds of things. But that was the beginnings of deinstitutionalization, of people moving out of those outside communities that we know about and moving back into the community. So those 5 things sound a whole lot like something that got to be the basis of what we do in independent living. Does anybody know what those 4 things are, 5 things are? What is the civil rights movement talking about in independent living? Advocacy. Advocacy. That's where advocacy started out. We advocated to say we want to make changes to the community. The second thing, consumerism. What was that about? I'm sorry. Making choices. I had the option to make choices about things, and we'll talk about that again in just a second. But it was that concept of I'm the one who should make the decisions about what I want and how I want to do it. And again, as individuals, we got a lot better at doing that as people living in the community. But for people with disabilities, that was a brand new thing, because if you've ever read Judy Human's book, I'll leave it up here for you to take a look at. I'd like it if you give it back to me. But she tells a whole story about being disabled in Brooklyn and not having any choice about what went on in her life outside of her house. Within her house, her folks forced her to make a lot of decisions and to take responsibility for things in a time where mostly kids lived in institutions. They did not live in communities. Anybody know why Judy Human? Y'all know who she is. You know why she didn't go to an institution? Why didn't when she was born, her folks told her parents, you better send her away because she's not going to be able to do anything. She's never going to be able to accomplish anything. Why didn't she do that?
Her mom? Her mom said no.
It was her mom. And why did her mom say no? Again, if anybody watched the show last night, the last 3 nights, they were Jewish. They were from, I believe they were from Russia, and they were Jews, and they got out of Russia. And so when somebody said, we're going to come take your kid because they're not going to be able to do anything, what do you think our folks said? You're not taking my child, because they had a lot of direct experience. And so Judy gets this opportunity to stay in her own home, but that's not what doctors told her. Anybody remember hearing stories about that? About just I still know some people who have sons and brothers and sisters who are in institutions now because their family told them when they were born, that's it, just let them go. Forget you ever had them. That's what started happening. That's what was going on. But as we looked at deinstitutionalization and we looked at that model, we said, oh yeah, something's wrong with that. But that was all through advocacy. That didn't just happen all by itself. Come on with this. Okay, get too excited. Okay, so what we said was in the community, as we started, people started getting together and talking to each other about what was going on, because another guy, anybody know who this guy is? It's a picture of a man who's using a assistive device for breathing. Anybody know who he is? Okay, I don't know if we can see that on there. His name is Ed Roberts. Ed Roberts was another guy whose parents also happened to be from countries where they were not appreciated for who they were. When Ed was born, he had severe disabilities. He lived in an iron lung. And when he wasn't in an iron lung, he used a tube to help him breathe. So he's living in the community because his parents said to doctors and stuff, no, that's not happening. They're not going to an institution. So he gets to go all the way through grade school, just like Judy did in New York, and he was out in California. And Ed decides he wants to go to school. He wants to continue going to school after high school. And what do you think vocational rehabilitation said to him? No way, Jose, you just stay home and get back in your little, chamber and just, that's it for you. That's really all there is for you. And so what did he do? He went to the papers. He went to the newspapers. He was on 60 Minutes. And he said, you've just wasted a bunch of money by sending me to school and spending all that money for me to be in school. And now I want to go to college. I have the grades to go to UC Berkeley, and you're telling me I can't go just because somebody thinks I can't do it. And that's a waste of money. And so through his advocacy efforts, he gets to go to school at UC Berkeley in the 60s. And again, for people my age, we know that was a very, very virulent time in Berkeley. There were a lot of things going on, a lot of protests. So Ed gets together with other people with disabilities and says, hey, let's do something on campus here. Let's make this worth our time. And so during the day, Ed goes to school like everybody else and protests along with everybody else and gets involved in all kinds of movements. And then when it comes time for him to go to bed at night, he's in the hospital wing. And he's treated like a patient in a hospital. Yet when he's out in the community, he's the big mover and shaker. That idea that I can be on my own got him moving in the direction of I can do anything I want to do, and I don't have to be treated that way. So it starts to be a time of people thinking, people with disabilities, we're not broken. We just use different kinds of ways of getting around. We just use different equipment. We're not sick. We are who we are. Well, many of you would say, hey, guy using an iron lung is sick. Is he? He really wasn't. That's who he was. That was where he was going to be. Okay. The barriers to society were the problem, not him. The problem was the way he was treated as a patient in the dorm or the hospital. He was treated like he was a sick patient, and during the day he was treated as one of the guys doing protests and everything else. And depending on professionals, many times was the problem. Okay. And we'll get to that later. It doesn't mean you quit hanging out with professionals. It just means that letting professionals make all the decisions for you is many times where the problem comes in. And that's where we get into the medical model. The idea, this guy, another guy I'm going to introduce to you, Ed, had a bunch of friends eventually called the Rolling Quads that hung out on campus and made all kinds of changes. And if you've ever been, I got to go to Berkeley in the 70s, in the early 80s, going to graduate school. The whole community in Berkeley is totally accessible because of all the work that they did. This is way, way, way before the Americans with Disabilities Act. So he didn't just rest on his laurel. He didn't just rest on things. So this other guy, find him now, of course, Steve Brown, Dr. Steve Brown, came up with this idea that people with disabilities aren't sick, they're not the problem. And so he developed this medical model versus person-centered plan. Okay, it's a little slow, but it's really important for you to get the concept across because it's so easy, even in Centers for Independent Living, for us to take care of people or to try and fix people in community settings. What he said is the definition of the problem under the charity model is that people with mental or physical disabilities lack socioeconomic, political, education, and cultural skills. I'm going fast on you, sorry. What he's saying is that the doctors make all the decisions for you. The people in charge, the group homes, the supervisors are making all the decisions on your behalf. In a disability rights culture pride movement, the dependence is on the professionals, on family members and on others, on hostile environments, lack of legal protections. So what they're saying is that people ought to be able to make their own choices, given information from my parents, from whoever it is that's around, but that I'm the one ultimately who has to make the decision, just like most of us do now. Okay? The problem is that the community model sometimes it just messes us up so badly because they're making all decisions without even talking to us. I've had some issues going on with my knees and my legs, and I am stunned at the difference between being 50 and being 70 in how you get treated at a doctor's office. I don't know for any of you who are beginning to age, what the assumption is about older people as opposed to younger people when it comes to making differences about taking care of your knees or fixing, stuff that's going on in your body. What's the difference? Anybody else know the difference? Y'all are a lot younger than me. God love you. I'm happy for you. When you get there, let me tell you, you have to become a self-advocate. You have to become a self-advocate all over again because the assumption is you're a little old lady who sits home and takes care of your dogs, and that's all you do all day long. So why would you need to get a new knee? Well, because when I'm playing golf, it really messes up my game. And when I'm out sailing, in the water, every time I go to get over the thing, I got this thing in the back. It's the assumption that we're all sitting home doing nothing, just like what they did to people with disabilities at the beginning of this movement. You can't do anything, you're really not going anywhere anyway, so we'll just take care of you and make you happy. And many times just give you pills to keep you quiet, let's just do that. Okay. The locus of the problem in the community model is that you're broken and you need to be fixed. We'll do the best we can to fix you up to the standards that we think you belong. Angie and I have had many conversations about her daughter who had a severe injury in her leg, and the advocacy that she had to do just to get the school to listen to her and to acknowledge things that were in the law. They were already in the law. But it's that idea of you're sick, so we'll just kind of ignore you until you get better. And then when you're back to normal, whatever that means, then we'll let you play with us again. In our model is that we have socioeconomic, political, education, cultural environments and perceptions. We're the ones who know what's going on. But if we don't, if I just do whatever they say, and if Angie never goes and complains to the school about what they're doing to her child, what happens? She goes away. Yeah, she goes away. They would prefer not having to worry about, oh gosh, we forgot to make the whole school accessible. Or gee, that 504 plan, what's that? What's that? What's that about? It's those kinds of attitudes that go along every day. And I see them every day. And the more training that I do, the more frustrated I get sometimes. Some places are doing an awesome job. But when you get into, especially in smaller towns where they haven't really heard the news, that attitude of you just do the best you can, all right? And you really can't come to the show. We'll have, we'll tape it and send it to you, or something that does not include you. We have got to be the advocates. We've got to decide that if I have any kind of political power, I'm going to be able to make changes. Okay. If I don't, if I just let it all go along, let everybody else make the decisions for me, that's where I am. I stay in that community assistance medical model. Thank you. We're seen as patients, charity recipients were non-existent in a disability rights pride community where family members, we have children, we have customers, we're co-workers, we're advocates. One of the best ways to get people to understand what disability rights are about is to talk about jobs. We want to get jobs. We want to have the same opportunities that everybody else has to be employees, to be employers, to run for president, to run for the city council, to be involved in politics, not just be sitting back and watching everything happen to us, because that's when you have the power, when you are the ones who start to make the noise and make the difference. Solutions to the problems are in the regular model, professionals, volunteer interventions, and treatments. In disability rights is socioeconomic and political and cultural options. We have the options. Now, those options are there for everybody. It's do we take them or do we leave them? Do we take them or do we just let somebody else make the decisions for us? Sometimes it gets frustrating and it gets really easy. And for any of you with disabilities, I'm sure you've had days where it's just like, oh, just let them do it. Just let it go. I just don't want to screw with it anymore. And our job as advocates is what? What? Yeah, we can't let that happen. We can't let that happen. We have to encourage everyone. We have to nourish everyone. That peer support that is part of our goals and what is one of the most important parts of the Center for Independent Living becomes, if you're feeling bad about today, how do I get you to talk to him who's feeling pretty good today? And he's going to help you work through that. Mike Oxford, if anybody know him, when we used to talk about people getting jobs or getting involved in politics or something, and somebody with disability say, I can't, I got a bad leg, or I use a wheelchair. And Mike would call that the weenie factor. He'd say, you're being a weenie. What can I do to help you be able to do that and feel comfortable about it? But the answer isn't, no, you don't have to play. It's you get involved and how do I help you do that? It's a lot easier for a peer to tell another peer, this is what you can do, this is what is available to you, than it is to have you just sit around and stay at home and say, well, I guess I can't play golf anymore. And the doctor would love that, because then they don't have to pay for Medicare to get me stuff so that I can be independent out in the community again. The things are still against you. They're still towards, oh, just stay home and you'll be okay. Because the less I have to make things independent, the easier it is for the rest of the world, we think. who controls the individual or the group. Now, I said before, and I'm talking to somebody who is a provider, does that mean I don't talk to providers at all? Yeah, of course not. Of course not. What do we do with providers? They are an incredible resource. They're incredible resources. So what do I do with my doctor who says just go home and you know, make stuff, knit stuff at home? You're okay, that you shouldn't be playing golf anymore. What do I do with a doctor like that? Huh? Hire them, or maybe do some education and say, you know, that's not what my life is about. What do you like to do? Well, I do too. Sometimes it takes a little research and it takes a little work to find a doctor or a professional who's going to treat you in that way, who's going to give you the options and let you know what's available to you. Then you make the decision based on information you have. And we spend a lot of time talking to each other about what the options are. But then I make the decision because the decision is going to affect me. That puts me in charge. And it makes her a valuable asset to have. Because when it comes time for, you know, for me to be sick and I need to know whether I can be out or not in public, I want resources to give me that information so that I can make an informed choice. Okay. Desired outcome is I have pride in the unique talents that I have. And the other one is we just try to fix you the best we can. Those social misfits. Okay. Judy Heumann, the lady who wrote this book and who also has been involved in the disability rights movement for a long time. We'll talk more about her later when we talk about the 504 regulations. She says independent living is not doing things by yourself. It's being in charge of how things are done. What she mean by that? What does that mean? In your own words.
Let's say that if she's needing help with cooking her meal, but she has the right to identify what she wants to have, how her meal's going to be cut, and stuff like that.
Exactly. What kind of meal do I want you to fix for me?
Mhm.
What time do I want to eat? Just because I have a disability doesn't mean I have to go to bed at 8 o'clock at night, because that's what time works best for you. How many of you live independently? Do you? So you make your own clothes and grow your own food and.
No, but I have a choice about what I eat, when I work.
That's exactly what she says. It doesn't matter what you do, it's being in charge of how it gets done. I make the decisions about what store I want to go to. I make the decisions based on my income, what kind of car I'm going to get. I make decisions about how often I'm going to go or not go to the dentist or the doctor. I make those decisions. I'm in charge of how it gets done. And I do make the decisions about what you do with doctors and with salespeople and everything else. I make the final decision based on the input you give me. And sometimes I'll do a lot of research. I'll ask Angie, how do you like that card that you have? Or you know, what do you think about the movie that we just saw? Are we going to go to that or not go to? I make the decisions based on what I need and what my wants are. And then I figure out how to get there. I'm the one in charge. That doesn't mean I do everything by myself, because nobody does. Nobody does. We all depend on each other. I think one of the biggest challenges that I've seen over the years with independent living is 9 times out of 10, if I'm having a problem making a decision, I'll call my friend and go, hey, what did you do in this situation? You know, or would you just come with me to the store when I go to pay for the car? Because I feel like I could get a better deal if I had somebody else with me. You know, I have friends that help me make those decisions. And in some cases, it's professionals. It's people that I know to say, hey, can you help me out? Because I don't know the first thing about where do I go to get a COVID shot? You know, where is the best place to go? I don't want to go just anywhere. I have those resources available to me. And for people with disabilities, many who have stayed home for a long time during their lives, they don't necessarily always have those options of talking to somebody else. How did they get that? Oh, I know you know the answer to this. What do you do every day for your business?
Resources.
Yeah, I help give them resources. I help give them options. Sometimes I am the option. How many of you have peer support groups? Anybody have peer support groups as part of your center? They are invaluable in terms of helping people to make decisions based on input from other people and experience. That's the most important thing in the world. But again, I'm not going to go to somebody who's going to tell me what to do and not give me any options. I want to go to somebody who's going to give me resources and say, gosh, this worked for you. I don't know how it will work for you. Okay, does that make sense?
Mhm.
So that's kind of the basis of what we're doing in independent living all the way around. Those are the basic skills that we're teaching. How many of you have peer support groups? How many of you have socialization groups? Anybody? Okay. How many of you have independent living training? So that if I can't do something by myself, somebody can help me learn how to do it. Okay. Those are all pretty basics. What are the other skills that you have to provide as a Center for Independent Living? Independent living, information and referral, advocacy.
The institutional.
Yeah, it's my favorite, biggest word I know. Deinstitutionalization. And transition programs and information and referral. Information and referral many times is doing training with non-disabled people to get them to understand what they should be doing or not doing, or how they can benefit people. Okay. So that in essence is what the Centers for Independent Living came up with, is what they wanted to do. The difference between now and yesterday, when we first started independent living centers, was that and probably you and I are the only two that remember that, is that we didn't have a lot. We got money. We were told to do good things and report back on how you did, and we did. And we accomplished a whole lot of things, but there were not a lot of checks and balances to see how we were doing what we were doing. Some of the centers moved forward and did great things in that kind of a model. And most of us loved it because we didn't have any kind of recording we had to do. I mean, you can't believe how fun it was. Now we have a lot more rules and regulations because somebody said, we're not giving you that money for free. You're going to have to show us how you do it. So many of the things that you do, much of the time that you spend is recording and showing information. So you're in another world than where the independent living centers originally were, but that's not unusual. And it's not like unlike most other organizations or entities. Okay, questions? Anything? How about a 5-minute break? And then we're gonna have you break up into some groups. Okay, any questions? Anything that, if you disagree with something I say, I'd love you to speak up to tell me what you think, okay? All right. it becomes a challenge.
No.
Every time I say, hold the computer, like, but I haven't heard. Did you need water?
Is it particularly cold in here?
Are you cold or hot?
Well, I'm okay, but I wonder how everybody else is doing. Are y'all like cold or hot or? Cold, okay, yeah, I think a lot of people are cold. I do not want it to be too warm because I will lose you.
Kind of a shock out there today after weather we just had.
Exactly. It's been so hot, yeah.
We're right at.
Woke up this morning. Oh, yes. I have two big dogs, but I think it's time to have fun now. It's finally cool out. I can play out there. Okay, how's everybody doing? What I'd like to do is have you talk to each other for a while here now. And I don't know how we want to do this in terms of breaking up, so that we can like move people around. I'd really like it if you'd go to different groups, like, maybe if you'd come over here and
We can count off numbers.
I was gonna say,
we could count off numbers. You want to do that?
Yeah.
And then we'll just move around. Most of you look physically like you can just wheel your chair around. So we may have to move the chairs out a little bit, but how about we start with, I'm gonna leave you here because I know you need to do that.
Thank you.
How about 1, 2, 3?
Okay, 1, 2, 3.
Okay, now, there's just a rule here. You gotta remember what number you said.
That's why I have my finger.
Okay, so got 1, 2, 3, 1. 1.
All right,
Yeah.
three, okay, can I have one?
1, 2, 3. 1, 2, 3.
Okay.
1.
Oh, wait.
No, this is.
That's why I just keep.
Yeah.
1, 2, 3, 1.
Over here.
I have 1.
And 2 in the middle.
Thanks for joining.
Double know where you're supposed
I didn't read. I didn't know. Very.
What number are you? Are you 1?
I am.
Hey, how are you doing? Good.
BYOC. Yeah. We introduce ourselves.
Okay, so are you, sorry, you didn't take her. Before that, so we just gave somebody to keep notes.
If my second stop where we go.
Somebody to take them.
She's got a pen.
No.
You could drop her off. You're important. We're both very aligned. Look at you, Gina.
How about you guys? Tell me, but we should have made one. Everybody, I should have thought of that. Or else we'll be doing different ones, but this is good. When did you first hear about people with disabilities? Where did you hear it from? And what was your first thought? Like, how did you find out about people with disabilities other than knowing that they were away? How'd you find out about them? What was your first thought about what do I do? Or how do I get involved or not get involved? Or, tell me more about where it came from. Okay. You learn that.
It is. Gina, for those playing at home.
Yeah.
If you want to give them some instructions here.
Okay. Okay, so for the Zoom group here, what I'd like you to do is talk with your friends and tell me about when did you first hear about people with disabilities? Where from and what was your first thoughts about it? If you were a person with a disability, how did you let other people know who you were and what you did? If you weren't, if it was new to you, how did you learn about it and what did you think? Okay, and we'll get about 5-7 minutes.
And that's really what. How they were. My heart.
So I'm going to mute this line while we have the discussion and I'll unmute when we come back to share our ideas. So there's a lot of group discussion going on, so I muted the line. I will bring it back when we come back to share our thoughts.
How's everybody doing? You have any questions or anything you wish I would get into or listen to or? I can't, I'm not hearing.
No, I don't see no comments or anything yet. So. Feel free to enter your comments into the chat. And
We have.
Gina's read through the ones that we've already submitted. So thank you for those.
Start out with that. Okay, so, you'd be willing to read the comments that we got back from what we heard from the folks, on Zoom. We had some really good comments from them, so let's take those first.
All right. Phil at Beyond Barriers shared that I worked with the homeless for 13 years. A big focus was on dealing with the aftermath of deinstitutionalization back in the mid-70s. Releasing people from the mental health facilities without supports was a terrible situation. And Chelsea, also at Beyond Barriers, shared.
I grew up around students with multiple different kinds of disabilities. And I mean, one of my people that I got to know was a boy that very limited, verbal communication skills and had trouble walking. And there I kind of started paying attention. I was in high school And I also was paying attention to other students as well. And I found some teachers followed IEPs real well. Some of them did not follow IEPs. And I mean, and it still goes on today. The IEP stands for Individual Education Plan. And as students age, I thought students were supposed to participate in their IEPs, but they're not. I mean, some schools say, hey, yeah, let the kid get involved as they age, and others not so much. It's
Thank
kind of
you.
sad where they're talking about, a kid's educational goals and the kid's not around. So
Thanks, Chelsea. Mignon shared that she learned about the Rehab Act when she was in high school and started getting reader service and other items that helped her with her schoolwork. And another comment was about there's not a lot of support for single males with disabilities at all. The primary way people dealt with their issues was incarceration. Next comment's about in the late 70s, I had someone in my kindergarten class that was completely blind from birth and had the brailler in class. Everyone accommodated her, but we were in a private school. I worked with students with disabilities for the Special Olympics in Germany in the 80s on a military post. And they were in high school at that time. And then the last one looks like said, I learned about disabilities and the civil rights movement after my son was born. He has ASD and everything was new to me. I think that's so true. We learn about the disability culture and the life when we become members. So many of us. So,
One way or the other.
right.
Yeah. Yeah. Good responses. Thank you. Thank you. Is that Mignon from Dodge City?
Mhm. Yep.
Gosh, I haven't
Yes,
heard
it
from her
is
in a long time.
She says hello.
Hello, how are you?
I am fine. I haven't gotten to hear you speak for a long time either.
No, we're both old.
Well, we are, but we won't tell anybody.
Okay, that works for me. Nice to see you.
Uh-huh.
Okay, how about this first group here? Why don't you summarize what you guys talked about?
Well, so somebody related that on a high school trip, they went to BNI, Art Institute. And we're pretty shocked at the pretty horrible conditions there. Another group member related that I guess the first exposure was mainly to reading and movies. And they commented how in the USA, people with disabilities are treated quite differently than they are in other countries. Somebody related that they were a senior in college, and they noticed that they were working in nursing facilities, how there were some pretty significant differences in how certain nursing facilities treated the residents as opposed to others. And this person ended up being a leader at another facility and moving to a person-centered care model. And another person with a disability in our group related to her first exposure to IELTS kids when they first started using
All right, any other comments you feel like got lost or?
I just brought up Willowbrook. For Geraldo Rivera.
Yeah. Yeah.
Some people here don't know who that is or anything, but. But yeah, that was, I remember watching that.
I lived on Long Island when I was in high school, and my father would work for Sears. He delivered stuff for Sears, and I found out, and again, I didn't know the first thing about disability rights, but I found out from him that what they did was when Geraldo Rivera was getting ready to go and investigate, do this big thing on Willowbrook, which was a great big state hospital in New York. Sears and all these companies brought all this stuff there, and blankets and clothes and beds and all kinds of things. And the minute they left, guess what happened? Picked them all up and sent them back again. It was a big bust. It was a big bust. Yeah. Yeah. Unbelievable. The crap that went on there. Yeah. How about this group over here?
Hey, Suzanne, sorry, I want to make sure that everybody online can hear. So if you don't mind coming up,
Okay.
here in front of the
That would be
mic
helpful, thank you.
and the camera and everything.
Do I need to introduce myself?
Sure.
No. Okay. Well, we kind of my group kind of first heard about, disabilities like in the 70s, 80s and 90s, because we're all different age ranges, but, Dion said that it wasn't until her family members had kids with severe disabilities that she heard about it. And then I didn't really hear about disabilities until I started in school. And then a lot of other people said it was around school age that you hear, but a lot of them were kept separate or segregated. Like whether it was in the basement or in an annex building. And that was even up into the 90s. Late 90s, when it was already illegal to segregate people. And kind of the first thoughts about disabilities was we were all fascinated, wanted to know more, curious, wanted to know the differences, how they got where they were. Just kind of a lot of, new feelings. And then there were disability specific groups, such as spina bifida, and clinics that you were referred to back in the 80s. And that's how you learn more about other people with your same disabilities.
Right, great. All right, thank you. About the last group, if somebody be willing to come up. So we can hear you. Hey, come on, Janetta. I know.
Really, our group just basically talked about how, when our first interaction was with people with disabilities, how we felt. A lot of us have somebody that we know that has a disability, or our first experience was in school with people with disabilities. My first experience was my husband's best friend's daughter was born with spina bifida, so that's pretty much it.
Anything else?
I was 10 and my new step grandmother forced me to volunteer for an ARC event. Well, I mean, I was staying with her for the week. She's like, "You're coming with me." I didn't go kicking the stream or nothing. It was cool. They were gonna play tennis and stuff. I'm like, all right. But yeah, it was my first time. I was kind of blown away. It's the first time I realized there was a group of people in the community that wasn't considered normal. But I had a great time. I loved it. I think that's part of what started my helping spirit. I got so much joy out of helping.
Yeah, a lot of the special ed and ARCs, the Association for Retarded Citizens at that time, it's just called the ARC now, but a lot of organizations brought people in, and once you got there, you forgot that they were people with disabilities. You just had a good time. You had fun.
It's really nice.
Yeah.
It's great.
Hey, for a lot of people, do you remember when you were kids? When you watched movies or you watched stories on TV, who are the disabled people usually, if they were in the show at all? Who were they? I didn't hear you.
Pollyanna, like she was the main character,
Uh-huh,
just a kid that fell out of a tree.
uh-huh. How about any other ones?
What's that show with that guy?
Harry
Mason.
Yeah.
Corky was the
Life
advanced,
goes-
yeah, it was,
Life goes on. something like that.
Life Goes On. Life Goes On was the name of it, yeah. And it was, it was one of the first times ever that a person with a disability, he had Down syndrome, and he was placed in a positive light. It was almost a little too much, a little too sweet, because everybody loved him in school, and you know, he was on all the teams, and everybody thought he was great, and God, wouldn't that have been nice if that was true? But before then, who was, anybody ever see It's a Wonderful Life at Christmas time? Who was the bad guy? Who was the mean guy in there?
Chair.
The guy that used the wheelchair, Mr. Potter, he was the meanest man in town. And,
Wasn't.
yeah, and who was the meanest person in the Wizard of Oz? The Wicked Witches, the Wicked Witches. You know, for years and years and years, many of us grew up with people with disabilities were either evil, they were bad people, or they were clowns, they were knaves during you know, in old English movies, you were always an idiot if you came and you did stupid things and, you know, acted, or you were evil, you were doing something evil. There was never a point where it was just a person with disability who kind of was part of the group. Or they were so spiritual and wonderful, you know, that they were way like Corky, which the concept was a good one, but he was so amazing. No teenager could do what he got done. And, you know, this kid had a developmental disability or Down syndrome. So we kind of moved from a place where we put people away in institutions because that was the best thing for them. That's what happened to people in a lot of those movies, a lot of the movies about insane asylums in the early days. It was horrible, terrible conditions, but what was it? It was the best they could do. It was the best that they could do. So many of us, as we were growing up, we grew up with that concept and we didn't even realize it. You know, we didn't even realize that we treated people differently. And there's a whole thing about people who are really, really beautiful and people who have severe disabilities, in many cases are on the same plane. Now, why would that be?
They're all stared at, maybe. They're all stared at if they're beautiful.
Exactly. They're treated differently from everybody else because they're so beautiful that you don't feel like you can get to know them. You know, you have these concepts about them, or they're mean, they're self-centered, they're, you know, wanting to take over. And people with disabilities were kind of on the same plane. And there was this whole research about that, about how they were very much alike. And you never would put those groups of people together. But that concept that we all learned. What did you learn when you were a little kid? For those of you who are older, what'd you learn when you were a little kid about if you were walking down the street and you saw somebody using a wheelchair? What did your mother tell you? Don't stare at them. Okay. Well, what would happen? We never knew. Yeah, I just knew you weren't supposed to. Like, would I go blind or what? You know? That idea that somehow there's a difference there, and our parents did it so that we would not be mean. I mean, they did it with the best intentions, but what we heard in our heads was something's wrong with them. Don't talk to them. Okay? We were given that information. And so no wonder when we first saw kids with disabilities, we were a little confused. We were a little mixed up about what was going on. And then, of course, everybody with a disability went to institutions, so you really didn't see them. Or even if you did, when 94-142, the bill that said people with disabilities deserve free, appropriate public education, that was in the 60s, late 60s. Did we really see kids with disabilities in school? Who said it? Somebody said it.
In passing.
Exactly, because they were in another building or they were down in the basement and that's exactly what happened to Judy as she was growing up. She was in the basement, you know, until she did enough fighting and arguing to make sure that she got to go to a regular classroom. And then she went to LIU to graduate school. And when she graduated, she wanted to be a teacher. And guess what they told her?
No.
She couldn't be a teacher. Why not? Fire hazard. It's the Judy Human fire hazard story. If you're a person with a disability, you use a wheelchair, and you're teaching kids in a school, and there's a fire, how do you get those kids out of the classroom?
same way a person without disability does.
Well, that was Judy's argument. That was Judy's argument, but she couldn't teach school. She had to teach. She's Jewish. She had to teach in a Catholic school because they were the only ones who would let her work with kids. And I wondered about that too. What did that have to say? But she couldn't teach in a public school until laws started getting passed that allowed her to be able to do that. But she was a firehead. She always tells the story. It's a great story. She always tells a story about when she wanted to go to the movies. She would go, to the movies and go down the aisle. And she'd be sitting in the middle of the aisle in her motorized wheelchair. And what would they do? Throw her out. They'd move her. She had to get into a chair and sit in that chair, so she had no way of getting out if something went wrong, or what? They'd throw her out of the movie. Why? She was a fire hazard. And then she got to thinking, well, they must think that people with disabilities are like instantly combustible because everywhere we go, they think a fire's going to start. And it was an excuse to not have to deal with people using wheelchairs. Somehow the assumption was that she was going to sit in the middle of the row, and if a fire did happen, she'd block everybody. Instead of getting out, she would block everybody from getting out of the building or out of the school or out of wherever she was. It's the wildest thing in the world. All those laws went into effect long before things really started happening, where you just go to classrooms now and you see kids in classrooms just like anybody else. And so it starts to become no big deal. It starts to become, tell me about your talents. I don't want to hear about your wheelchair. I want to hear about what you know. What's your favorite book? What class do you go to? What are the things that are interesting to you? But as soon as you look different again, and I keep picking on your daughter, and I shouldn't be, but if your daughter has got this big wheel, big thing that she uses on her leg because she broke it, she becomes the center of attention. Everybody wants to know, and they don't want to know about her. They want to know about that wheelchair and what is it. I used to have a lot of friends who would say, just tell me anything you want to know. Let's get it over with to start with. Okay, here's my chair. I use it for this. I use it. And in some respects, that was really a positive thing because it let people get rid of the scare of it all. It's like, I just use it. It helps me be independent. Using a wheelchair is not a negative thing. It's very positive. It's very freeing because it allows me to live in the community and to access the community and be part of the community. Using a cane helps me to access the community. It doesn't limit me. It as I learn how to use it, it invites me to be part of the community and part of everybody else's world, just like what we say we're all about at the Center for Independent Living. Okay, good talk. Any other comments from the group? I don't want to leave you out. Okay, so I'm gonna just go through these real quickly. The reason I want to get to these is the Rehab Act in 1973, as people were starting to organize and groups were organized all over the country. There were blind communities who were working on civil rights. There were people with physical disabilities. There were all kinds of folks, a lot of folks from like ARCs that we talked about before and developmental disability groups were arguing for more rights for people with disabilities. So stuff was going on all over the country. And so they were working on getting laws passed. And so in the early 70s, after much work from a lot of people, in 1973, the Rehabilitation Act of 1973 is passed. And it's a big deal. I mean, it's a big celebration. People all over the country were just wild because they said Section 504 says no other qualified individual with a disability can be denied from services if there's federal funding involved. Okay. So much like other civil rights laws that happen around the country, if you have a disability and you use any kind of federal dollars in your program, services, companies, you could not discriminate against people with disabilities. So the concept was, if you got any kind of federal funding from the state or from state or local governments or private entities, and who doesn't, who do you know that doesn't? You could not discriminate against people with disabilities. And so 504 becomes our civil rights law, and everybody's all excited. If you know how laws work, anybody do any lobbying or legislative kind of activities? Laws get passed, and the concept of them by the legislators, by people in Congress, the law gets passed, and then what happens to it? It gets sent to an agency to get it implemented, okay? The head of the agency is the one who dictates when that happens. If you worked in school districts, if you worked in childcare, if you worked in any of those programs, you know that just because the law gets passed doesn't mean anything ever happens to it unless somebody advocates or strongly encourages it to move along. So 504 passes, everybody's all excited and just going out of their brains with excitement about it, and nothing happens. And it goes on and on and on, and nothing happens. And so the disability community, and again, this is back in the 70s, there were not, no cell phones, there was no internet, there was no way to communicate with each other except by making phone calls and going places and physically talking to people. And so they organized. They brought together a whole bunch of people, and there were big hearings there were big demonstrations in New York City in the middle, if you've ever been to New York City, in the middle of New York City, like on Wall Street and Broadway, and one of the big main streets, they had this big demonstration, and they just stopped traffic. And the same thing happened in many cities around the country. People got together and they had a demonstration. They said, we're not moving until you implement this law, so that Section 504 becomes a reality, so that people with disabilities can get jobs, they can go to school, they can do the things they want to do. And in California, Judy Heumann and a lot of other people, but Judy's kind of the star of that show, puts together people, and she gets over 600 and some people to come together, and they go to the federal building in San Francisco and they take over the federal building. This included people with developmental disabilities, people who were blind, people who were deaf, and they had no organization about it whatsoever. People with disabilities don't organize very well, they act. And so they're all in this building. Some of them had the foresight to bring clothes and some stuff that they needed, because a lot of people with disabilities, if you've been around people who have physical disabilities, they need catheters, they need to have food at certain times during the day. Sometimes they need tubes for doing feeding. They need personal attendants. They need all those things. So all these people come together in this room, and then they start figuring out, how are we going to do this? And they take over the building and say, we're not leaving until somebody does something. All right, let's jump ahead. Keep going. Going. We'll go back to those. Keep going. So the protests start to happen all around the country, and people go, this is not going to work. We have fought for this. We have, done everything we could for this, and it isn't happening. Next one. So in April of 77, these sit-ins, 504 sit-ins happened. Hundreds of people took over. And in a federal building in San Francisco, they were there for 26 days. And that's an arbitrary number, because some people didn't leave right away, but the official number is 26 days. Now, can you imagine the people that you work with who come and work with you or work at your center? Can you imagine just being in a building for 26 days? It was insane. It was just wild. They had to find attendants, they had to bring people in. They were, talking to a staff there to be able to make phone calls, because again, no cell phones, no internet. They had to, steal phones so that they could call people and say, get us some help. And eventually they got some reporters to come in and start making some noise. And it was going all over the United States. The other groups really, for the most part, only lasted a day or so, but this group 26 days of people with significant disabilities saying, you know, we're not leaving, we're not leaving. And they have this big event. And you can learn a whole lot about it. Again, that book is available if you want to take a look at it. You can get it on Amazon. You can download it. You don't have to buy the book. You can, they implement it, and they finally get the guy who's the head of, at that time it was Health, Education, and Welfare. He comes to San Francisco and he says, okay, you win, we'll implement it, you know, and he's the head. Joseph Califano is the head of HEW. He comes and actually meets with Judy and her whole group and says, what do you want? And she says, we want our civil rights. And he says, yeah, I understand what you're talking about, which was the biggest mistake he ever made, because Judy goes, you do not understand. You don't have a clue. If you had a clue, you would have implemented this law years ago. And so just got everybody fired up and screaming and yelling. And so they promise that they will implement the law. So everybody goes home, right? Another big victory. Everybody's all fired up. What happens? Nothing. They screw around again. And so long time goes by. They go to Washington, they do sit-ins in people's houses in Washington, and finally get 504 implemented. Well, it has a huge effect. That was right about the time that I was going to work at the Whole Person in Kansas City. It was my first Center for Independent Living. And when I got there, it was right after the law got implemented, and I'm getting calls from people from Tasty Bakery. All of these companies are calling and saying, can you come and do a access survey for our, and it's like, what? What are you talking about? Why would Tasty Bakery need me to do anything with disability rights issues? Think about it for a second. Tasty Bakery makes bread and they supply it to schools for school lunch programs. So they're covered under 504. So they have to be accessible. They have to offer jobs to people with disabilities. They have to show that it's a reasonable accommodation to provide. So we're teaching about reasonable accommodation. We're teaching about all these things to all these companies. A lot of the places, a lot of the telephone companies, anybody who was getting federal funding for anything that you did. And if you know, most people do, it was a great victory because finally people had to comply with the law. And it was that one section 504, no otherwise handicapped person by virtue of their disability can be denied services. And it also included schools. It also included schools. So the schools were no longer allowed to discriminate against people with disabilities. Now, well, kinda. Schools were told that they had to do 504 plans. Anybody know what a 504 plan is? Anybody ever hear that? Not so familiar, huh? Because when 504 passes, we were going around, we said, the heck with Tasty Bakery, I'm going to the school and say, hey, let me see a copy of your 504 plan. How are you going to make sure that people with disabilities can get into the school? How are you going to make sure that their parents can come if their parents have a disability and they want to come for a meeting with their kid? Oh, no, parents don't have disabilities and, have kids. That's not a lot of education, a lot of training, a lot of information went on. And they would just get scared to death. So that kind of went away for a while and the schools got by with it, but the organizations kind of were making some progress. They were doing some cool things. Anybody who was getting federal funding, they have learned from years and years and years, like, we don't like it, we don't understand it, it's a federal regulation, but we're getting a whole bunch of money, so I guess we'll do what they say. So things are moving along pretty nicely. The ADA comes along, and we'll talk about that in a minute too, but the ADA comes along, and what happens is we go back to schools and say, hey, can we see your 504? Oh, they call us and say, will you come and do an ADA survey here? And we said, well, sure, show us your 504 plan. And they go, what? A 50 what? They had no idea what we're talking about. Every school entity was supposed to submit it to the federal government. And of course, what happened? Nobody did. Nobody did. It just blew it off because there was no, nothing was gonna happen to them if they didn't do it. So when we went to do 50 or ADA reviews, we said to them, well, really, 504 is much more powerful. We need to see that before we look at it. ADA in schools only has to do when people come visit there. It's really, so we had to go back through it all over again, 504. It was like the law just passed it. So a lot of things happened. We were lucky enough, many of us in Center for Independent Living got to do that training and got to provide that information and got to do a lot of training around schools and businesses that use federal funding. Some of the national leaders as the independent living movement, because at the same time, I jumped through that real quick, but at the same time that the Rehab Act gets passed, Title VII of the Rehab Act does what? Title V is the big one because it's the civil rights law. What does Title VII do? You all have a job because of it. Centers for Independent Living, yes, Centers for Independent Living. They start up Centers for Independent Living, and one of the first ones in the United States is where? Hays, Kansas, one of the first rural independent living centers in the country. Paula was the initial Paula McAwee, for some of you know, worked for Independent Living Resource Center, was the first director out there. So Centers for Independent Living start getting funding, and we start seeing centers happening around the country. And we'll talk about our centers later on, but we start seeing more centers. We start seeing more people with disabilities going out into the community and beginning to make those changes and beginning to work on implementation of those laws that nobody knows about. A lot of what the centers did was advocacy efforts. They did, they did the 4 core services, but advocacy was a big part of those 4 core services to start to make changes. The city of Salina, we didn't even have a center here at the time, but the city of Salina had a federal grant and they built all these different sidewalks downtown and out on Broadway and all these streets, and didn't put any sidewalks in. And a guy and his son filed a suit with the federal government, and guess what happens? Not only does he get money for them not putting them in place, but what else? They got to put them in place. So all of a sudden, Kansas gets pretty good at it because Salina got hurt badly because of it. So other cities then start talking to each other and decide that they have to do something too. And so we start to see the growth of accessible locations for people with disabilities in different parts of the state. Some parts of the state still are not. When we look at courthouses, libraries, and what else are typically not accessible.
They put in sidewalks without curb cuts?
Yes.
Okay.
Yes. Yeah. So they had to go back and remove the sidewalks where the curb cuts weren't available and then put them in.
In our area, I just recently learned how the railroads up in the county.
That's a whole other big bad story.
They can make the sidewalk accessible as possible with the city has control over, but then there's this chunk of railroad,
Exactly.
there's nothing they can do about it.
It has been awful. I know I was working for the city at the time that they were doing that, and they were pretty aware of the rights of people with disabilities. When I worked for the city, I was working for, that was one of my jobs. I was the ADA coordinator. So we were getting a lot done in the city, and they were really open to listening to what we had to say. And you're exactly right. We would bust our butts to get these, curb cuts and everything all set. But if you're on the street and you're walking by, you could fall into the middle of a rail because they didn't do the rails right. And fighting with the railroad is one of the hardest things we ever tried to do.
That's what I was learning.
Yeah, and it continues to be an issue. They kind of got shamed here, and they fixed most of the main thoroughfares. They fixed them, but it took a long time and a lot of fighting. And God love the city manager here. He really put a lot of effort into making sure that happened.
Whole bunch of money just went into 6th Street in El Dorado.
Yeah.
Because a new school was built then it was an opportunity to redo all those sidewalks for the kids walking to school. Yep, 2 railroads were kind of jamming up the journey there. Everybody get a chair. Yeah.
So one of the other big things that happened under, at this time, under the Rehabilitation Act was the National Council on Disabilities gets formed. And the National Council on Disabilities is a federally funded program that reports directly to Congress on what's going on with disability rights and what the needs are for disability rights. What? Where'd that come from? Where'd that come from? Anybody know this guy? Anybody know Justin Dart? Okay, Justin Dart was this rich old guy from down in Texas. His father owned Dart Industries, the companies you see him whizzing by on the highway. Dart Industries does all kinds of sending stuff all over the country. Justin and his brother were rich, spoiled brats who used up money, drank, had a load of fun, and just a great old time. And both of them became disabled. And I'm not sure I ever knew exactly whether it was MS or what the disability was, but both of them became disabled. And Justin's brother committed suicide. And Justin goes, whoa, there's a greater reason why I'm here, and all this fooling around and, Rop House and all this stuff I've been doing. This isn't what this is all about. I need to start taking life a little more seriously. And so Justin gets involved with Martin Luther King and does a lot of work with him around civil rights for people of color, and starts getting involved in, and long story, and you should read his story sometimes too, because it's an amazing story. Justin and his father have buku money, and so they're very involved with the Republican Party and pay a lot of money to the Republican Party so that they can get elected under I'm sorry, Ronald Reagan. I have a blank. Ronald Reagan. And so Justin puts this group of people together, not only him, but other people with disabilities, including Evan Kemp, another guy. And they're all big time Republicans, give lots of big money. And they talk Ronald Reagan into creating the National Council on Disability. The National Council reports directly to Congress on what's going on with disability rights things. They get together and they create the first, they got together and said, what would it take to make the world accessible? What would we have to make the world accessible? And they just dreamed. And they put together, the first thing was the first report to Congress on disability issues and making the world accessible for people with disabilities. And they report it to Congress, and Congress doesn't know what to do with it. But National Council on Disability, which is an entity that you have to get appointed to it by, you have to be appointed by Congress and by the legislature and everybody else. They all got together and they came up with the Americans with Disabilities Act. And that's where in thinking the Americans with Disabilities Act was supposed to cover what? Because the 504 covered everybody who got federal funds, everybody who went to school. So ADA covers what? Everything else. Okay, so for private employers, for businesses, for in addition to the people who got federal funding, state and local agencies, it becomes the be all end all for everything we want to have done. So Justin and his family, he was married to a woman from Japan named Yoshiko. Yoshiko and Justin began to do advocacy efforts to pass the Americans with Disabilities Act. And it's almost lunchtime, so we're going to stop there. So is lunch ready, or do we want to take a?
Yeah, we take a break first.
Okay, all right, why don't we do a short break, and if they're not here, you get back.
Gina,
Yes.
this is Erica. Lunch is a little bit delayed. Rhonda just texted me.
Okay,
Probably have an extra 20-ish minutes before it gets there at least.
Okay, thanks, Erica. Then we'll do another quickie. What do you think?
There you go. I would say it's safe if if you wanted to take a break and then do another segment, you'd be
Okay.
safe doing that.
Okay, we'll do that. Okay. So
You wanna do a break now or you wanna?
let's do the break. Let's do like a 10-minute break and then come back and we'll do one more and then get ready for lunch. So it's 11:45 now. We'll be back in like 10 minutes.
We can stay in our rooms or can we will go back to where they were sitting for lunch.
For lunch, you can be anywhere you want, or the other thing, you can switch groups if you want to, just so long as we have groups of people to
Okay.
to do another kind of discussion.
So we're all set for a 10-minute break. Back here in about 10 minutes. You're online.
So what I'd like to know is during that, was there a time that you were involved, and I know some of you, because I know who some of you are, when you were involved in the independent living movement, and what did that mean to you as we could be advocates within the state and on a national level too? And how did that empower you to be able to make changes and to make things happen? And then what happened when those things went away and you didn't have that opportunity? Okay, does that make sense? Okay. Feel free to ask.
Very hard as we're in a boat. We're not trying to benefit from it. We're trying to benefit the community. We just make it for us.
If you have any comments to share with Gina, if you don't mind putting those in the chat. That way I can read them off and everybody in the room will be able to hear them. Unfortunately, the speaker on our computer is not very loud here for everybody to hear. If you can repeat that discussion topic one more time.
Sure.
Folks online,
Sure.
and then we'll go around the room and hear what folks have to say.
Okay. And the question that I gave to people was when you first joined the independent living movement, what did that mean to you and what has changed in the time when you first started working in independent living and as it exists today, what's the difference and are you in a position where you have some empowerment experiences where you've been around other people or you've been involved in advocacy efforts with big groups of people? And how long has that been since you've done it? Right?
The first comment we received was from Mignon, who said that she had just started working when she was involved in ADAPT and had never been around that many people that were living with disabilities all at one time. And she said it was an eye opener for her. Anybody else around the room? Feel free to come up and.
So, yeah, you want up and so we can, the folks online can hear you. Does everybody know what ADAPT is?
Oh, yeah.
Okay.
So I think the first part of the question was, when did we learn about the IL philosophy? All of us in our group learned about IL philosophy from working at an independent living center. So that tells us that the independent living centers are the gatekeepers to teach communities IL philosophy. Second question was, how has it changed? Or do we think it's better or worse?
Different. I didn't. mean
Different?
that. Yeah.
So in our group, everybody's pretty new. So. Okay, sorry, my memory's bad. Barbara, I got that right. So Barbara's been part of the IO movement for about 20 years and I have for 13. First thing that popped into my head was in 2011 when HCBS was given to the NCOs. And to have HCBS with people with IL philosophy and then have it given to people that are more of a medical model mindset, I see that as a setback. And I don't know if it's gotten better. I meet some case managers where it gives me some hope. They kind of, they can kind of talk IL philosophy with me, but I still meet some that are very medical model. So I believe that's a setback that's still hurting our people. Did I forget the third part of the question?
I think that we ever part of a movement or part of a advocacy effort. Either statewide or local or nationally, maybe done some stuff up at the state house or.
Well, yeah, I mean, we've been involved in lots of things as needs come up. But I kind of consider every day an advocacy action. Because every day you have the opportunity to help somebody learn how to advocate for themselves or encourage somebody, even if it's just like, man, you call every day and let them know you're serious. I mean, even just something as simple as that. So I think every day is an advocacy effort, one person at a time. And you guys agree with that?
Anything else? Thank you.
Okay.
Good job. Right over here, you guys. We could ask you to come up so that the folks out here can hear you.
We had somewhat of a wide-ranging discussion. Member related that they had gone to the NOFO conference recently. They were a little nervous because it's a new experience talking to legislators and things like that, but overall very positive experience. Very nice to meet lots of people in the IL movements. A couple of people talked about going to the Capitol here in Topeka to do some advocacy. It was great to be part of a group. Sometimes it's easier to advocate as part of a group opposed to individually. A lot of willingness, hopefulness, and that you're making a difference. A very powerful experience. And then something else related, just some of the difficulties with running and sustaining like local advocacy groups and efforts and how difficult that can be sometimes.
All right, great, thank you. Thank you. And back here.
I'll do my best.
That's all we're asking.
So our group had a lively conversation as always. About they learned it first from DCF back in 2007. Going to the different events, like going to the Capitol. And then of course there was we all lived through various funding cuts, which kind of changed the way we were able to quote unquote advocate for people through the legislature and whatnot. Of course, going to the nickel conferences. And then we kind of got, and I was kind of thinking of this even before we even were talking about it, is it's probably important to remember where we came from, and it helps kind of keep us focused on on where we're going or what we're really here for, actually, I guess I should say. And so I think that's a good conversation we had. And then also that leads into, we discussed for future generations. We felt like, you know, it's all tied together. From where we've been to where we're going, so. That was kind of our conversation.
That's pretty good. Anybody have anything else you want to add? Good conversation. This is not easy stuff. This is tough and much of what I think we all, each center individually needs to think about what do you do and what can you do and what's okay and what's not okay. You know, is it okay to talk to your legislators? Is it okay to ask people questions about what's going on? Is it okay to talk about what you feel like your needs are? Each center has to be comfortable with that and do it in your own way. And I'm not advocating one way or the other. I just know when we get ready after lunch, we're going to talk a lot about the changes and the differences that we made and the power that we had was when we all worked together and let all of our disagreements kind of go off to the side. How powerful and how much we accomplished and how much harder it is to do when it's everybody kind of doing their own thing and trying to figure out how to do it. And I'm not suggesting to you that I have an answer for that, but I'm going to keep challenging all of you to think about it. Before lunch too, I had a great opportunity to talk to the two very talented sign language interpreters. And talked about the fact that we can't find sign language interpreters in this part of the state here. And I was asking for their numbers and phone numbers and stuff. And I have a few phone numbers here. If you would like to have them, I'll leave them up here. If you need to get one, I can pass one to you. Our other interpreter here doesn't have any, but she will get information to us and we can get it sent out so that you have it for you if you need it. It's pretty hard to have a good conversation with an adult who's deaf or hard of hearing who uses sign language and you don't have it. And so how do we then get people who are deaf or hard of hearing involved in our organizations if we can't communicate with them? So just a thought. So anyway. So you're in charge now, Ange.
On the HS? I don't know, you have to make your own sandwiches. Figure it out.
And are you collecting money for them or?
I am assuming from the email that I got that either some people were sending in checks or if you had any money with you, it was $8.
Okay.
And Rhonda will take it. Yeah.
Right, so
What'd you do with
we'll give it about 30 minutes or so. For sure to be back for the rest of the presentation. We're going to take a break now for lunch. And I'll be muting this line. But we'll see you back here in 30 minutes.
The speed of sound.
All set.
Okay, so the National Council on Disability puts out this missive to Congress about how the world should be flat, and if the world were flat, people with disabilities could get along just fine. And nobody listened, of course. And it sat and sat and sat, and we had some advocates that got together and a lot of names that you probably don't know anymore. People some legislators really took it to heart, and Bob Dole was one of them. As a matter of fact, we were pretty important folks in Kansas because we were constantly having to go to Washington to talk to Bob Dole's office and work with them because he was pretty powerful and of course was a big supporter of the bill. Just to finish up the story with Justin Dart, the guy I was telling you about before. He was the rich guy with lots of money and lots of support for the Republican Party. And so he very much helped get George Herbert Walker Bush elected to the presidency. And he worked very hard with George Bush to get him to listen to what we wanted to do with the Americans with Disabilities Act. And as many of you know, he's one of the first Republicans in a long, long time that actually passed a piece of civil rights legislation when he signed the Americans with Disabilities Act. But along the way, it gets introduced into Congress and not a lot happens with it. There are many legislators working hard on it. Justin Dart made a trip around the country on his own dime. He paid for it himself. He and his wife came, Yoshiko and Justin came, and they went to every community you can think of and just talked about people and asked people to talk about their discrimination diaries, he called them. What happens to you on a day-by-day basis that causes you not to be able to have a job or education or employment or any of the things that people without disabilities have access to? And so he went to these town hall meetings and got all of these discrimination diaries and he put them together and they sent them all to Congress. And that had a great effect and things started moving along. We were going to a nickel meeting, again, that bringing everybody together to get that power going. We had a nickel meeting and about 600 people came to the nickel meeting. And while we were there, we were sitting around in a room talking and Judy Heumann said, why aren't we doing something about the Americans with Disabilities Act while we're here? You know, why aren't we up at Congress making some noise? And they said, oh, come on, Judy, we have board meeting and we got this, and we got that. And she goes, well, with all that, let's do something. Let's do something. And next thing you know, like 5 minutes later, she's organizing a rally up to the State House. And so lo and behold, it happens. 600 of us get posters and all kinds of things put together, and 600 people march from the State House up to the Capitol, up to the president's office, and demand that we do something about the ADA. Well, we had so little time to organize this because we had to get permits and we had to do all kinds of things to make this happen. It started raining in the middle of it, so we had to go buy big baggies so that everybody had baggies over their heads so they didn't get soaking wet. We get up to the White House and we get to the door, and the lady who's the president of National Council on Independent Living president gets there and she looks at somebody and goes, well, now what do we do? And everybody just looks at her and goes, I don't know, we didn't plan that part. And she just starts talking and she said, we demand civil rights. You know, we want our rights. We want to talk to the president. And the guy at the gates of the White House comes out, the security guard, and he goes, you got to get out of here. You know, you're all going to get in a lot of trouble. She said, we demand to see the president. And so he goes back in, you know, to his gate and comes back about 5 minutes later and said, I can't believe this. This has never happened before, but they're going to meet with you in the morning. Now, you can't have all of them come, but they'll come and meet with, you know, if you bring like 6 of them, they'll come and meet with you in the morning. And it just blew us away, you know, that here we were going to get this audience just from nowhere. And how powerful do you think people felt after that? Well, there it was, who gets to go? And so many of the people who were new to the board, including me, I had just gotten elected to be on the board. I get to go to the White House for this meeting. And the people at the gate said, but you have to give us your name, your social security number, and your birthday. And I said, okay. So it was like 6 o'clock that night. Next morning, we get there at 9 o'clock. we go to the White House, where you walk into the White House, and they had a stack of papers this big on everybody's name. Like, oh my God. And I was just a little peon from Kansas. I wasn't anything important. So just don't know how much they know about you until you find out. But we had this great meeting. We had a meeting with the counsel for the White House, and we got things moving. And again, that sense of empowerment that comes from everybody working together and everybody joining in. And it was some kind of feeling. I'm sure you remember some of the stuff we did with Castle too. That feeling of empowerment that they're listening to you, that they're hearing what they're saying, and that they make a change. And eventually the ADA becomes law. Now, I'm making this really short. It was a long, hard process. I think I went every week to Washington to advocate and to lobby and to do all kinds of work, but the ADA passes. And it's a big, exciting thing. And everybody says, well, you know, who's going to get to go? And everybody wanted to go. And oh my gosh, they didn't know what to do with that. So anyway, big celebration. And now the ADA passes, and here we go. Now we have to start to, again, go back to Congress and get them to implement this law. It's always a lot more fun when you get it passed than when you have to implement it. In 1988, with National Council on Independent Living, we also got the amendments to the Fair Housing Act passed, the Air Carriers Access Act for people with disabilities who want to use airplanes. There were changes that were made there. We're still working on making better changes if you use a wheelchair or you need a guide to help you get in. There's still a lot of problems, but we made changes there. And the Civil Rights Restoration Act, which included all the rights for people that were taken away and were downsized. All of that happened in the same year. And the reason that it happened, the reason that all of that got accomplished was because we joined forces with a lot of different groups. It wasn't just Nickel doing it themselves or the ARC or anybody else. Everybody came together and said, but there's a whole lot of things we don't like that you have sheltered workshops. We don't like that you have this. We don't like that you have that. And they said, we don't like that you guys are, out, chaining yourself to buildings. And we all said what we didn't like, but we all talked about what we did like. And so we went with we got the Rainbow Coalition working with us. We had the National Organization for Women working with us. We had the folks from Gallaudet. I don't know if you were around when Gallaudet had a protest because they hadn't ever hired. Gallaudet University is for people who are deaf and hard of hearing, and they had never had a president of Gallaudet who was deaf. They're always or hearing people. And so there was a big protest happening at that time. We joined forces with them. We all came together and we accomplished all these laws in a very relatively short period of time. Things got accomplished. We accomplished things. 1990 is the passage of the ADA. Signing of the ADA. So we had a whole lot of successes. The point I want to bring to you here is that when you work together with people, you get things done. When you try and focus just on yourself or just on one person, things don't happen. So I think whatever we can do to find resources, to find people that we have something in common with, even though sometimes we don't agree with everything that they say, if we can come together as a coalition for issues, we are going to be so much more powerful. And until we do that again, we're going to still be living with the Sam Brownback, MCOs telling us who's eligible for services and who's not eligible for services and all those kinds of things. So I just encourage you to continue to work towards Castle. I worked for Castle since they started. We were a very strong organization when we were all together. And I know we've kind of scattered, and I know I'm not getting into the politics of it. I'm just suggesting if we can figure out a way to start working together towards some common goals, even if it's just one thing. ADAPT, the organization ADAPT, only works on one issue at a time. They don't take on like a whole legislative agenda. They work on one issue till they get it done. Their first issue was finding attendant care. for people with disabilities, and they accomplished that. Americans with Disabilities for Accessible, or they started with accessible public transportation. The world now has accessible public transportation. So they changed their focus now to attendant programs today. They work on one thing. If we could figure out how to do that, if we could only get to where we figure out how we can advocate in a more productive manner to meet everybody's goals. And whether that's community living, whether it's, I don't know what you think the most important thing is now, but if you could figure out how to do that, it is so much more powerful than when you try and everybody, scatter and try and focus on what you're doing yourselves. Until you do that, I just feel bad because I think it's going to be a catch-up kind of situation. We're trying to figure out how to make things work. You are doing some very powerful things in the Centers for Independent Living around the state. You could be doing so much more. You could be doing so much more. You have the capacity, you have the power. As Justin Dart would say, I love you all, figure out how to play nice together. Even if it's just for one thing, to accomplish one thing. So I just encourage you as we go along. Going back to Kansas, we're gonna switch. We're gonna do a real quick run through. Let's skip that one. We're gonna do a real quick run through. As I told you before, the Whole Person, Link, and Independence Incorporated were the first centers that were federally funded. The Topeka Independent Living Resource Center was another one that eventually got funded through federal funding. So we had quite a few independent living centers for the size of our state, but we had a lot of advocates all working together too. All the center directors worked pretty closely in a way to make sure that funding was available. People like Ray Petty from Lawrence and I just lost his name from KU. No, from KU, from
Glenn.
Glenn. All those folks came together and did a lot of work to advocate for there to be centers for independent living. The next was they made some state funds available, and one of the first states that got funding on a state level, not national level, but a state level, was Independent Connection in Salina. We did a lot of advocacy efforts to encourage them to provide services for people with disabilities in central Kansas. And soon after, unfortunate name Project Aid was quickly changed to ILRC, but they received state funding. And so we were the first two statewide funding centers. Again, we all worked together with legislators, and it wasn't Republicans or Democrats. It was everybody working together to talk about what the needs were. And we had customers coming and saying, here's what I need, here's what I'm missing. And if I had this, I could live independently. If I just had this assistance, I could live independently. So that money was coming through. We had a state plan for independent living. We advocated for more dollars. And we put together CASEL, the Kansas Association of Centers for Independent Living, all the executive directors, and there were like 13 of them to start with. And once we got federal funding, there were 13 centers for independent living in the state, including Kansas City, Missouri. We were a pretty powerful force. And we advocated, and we got a lot more money for the Centers for Independent Living. And we got a lot of things to happen, a lot of things to change, a lot of improvements to services, a lot of improvements to funding so that people could live independently and we could create that. But we did a lot of empowerment too. We did a lot of working together and everybody coming together on feeling good and feeling successful in doing that. We went up to the state capitol. I was bugging you guys all the time to get up to the state capitol to talk about things, to get to know legislators, to do all the kinds of things you need to do to accomplish what you want to accomplish. We also advocated for self-directed services. That was relatively new. Nobody in our state or around this area had self-directed services. If you wanted to get services under the waivers, you had to have a nurse come in and tell you what you were going to do. So the self-directed model was something that CASEL was responsible for bringing, not just CASEL. I was looking at Martha when I went to the leadership conference. Martha Gaypart was really involved in that. There were lots of organizations that were involved with us with that. We had Valley Falls, we had Resource Center for Independent Living, we had Three Rivers. We got more funding for more centers. And eventually we had centers all over the state. Again, we changed the Nurse Practice Act that allowed people to hire their own director to provide care for them, where the person was in charge of who the attendant was, as opposed to the nurse being in charge of who was in charge. And that was a huge, we made a huge difference there, and a lot of other states recreated that so that we didn't have to pay for or have professionals there if we didn't want them. If we wanted to use our own attendants, as long as the person could teach the doctor or nurse practitioner how to do those things themselves, they could teach the attendants how to do them. And that's how it all worked out so that people could get services. Next big thing that happened was the Kansas Disability Caucus, where a bunch of people came to, again, we were at a council meeting one night, sitting around, I'm sure imbibing, dreaming of what we could do. And somebody started talking about the AAAs, the Area Agencies on Aging, every year brought together senior people, came together and did a, what's that called, where you do an initiative to create programs for people who are older. And we decided we were going to do something like that. And so they created the Disability Caucus, Kansas Disability Caucus, which happens every other year. It was a very powerful way to get people together. And again, that's why I was asking those questions before. Once you get people all together and you get them excited about what they're doing, you tend to make progress, because when you win, anytime you make small differences, people feel what? Feel empowered. Yeah, they feel like, yeah, we can do this. And the more we can do, the more we want to do, and the more we want to do. And it got to where the legislature was saying, hey, tell them to stop that. It's like, I can't tell them to stop it. You know, you call them out there doing it. It was an incredible, empowering thing. Ed Roberts, who was one of the big leaders that I told you about to start with, was the first person who came and was at our disability caucus. He came to Kansas to be part of our thing. And again, we were seen as leaders around the country because we had so much success and we accomplished so much with the disability caucuses. Kansas Act Against Discrimination. We have more permanent presence in Topeka. We hired an executive director. Mike Oxford, is, you guys know who he is. Mike also got involved with ADAPT in addition to running the Center for Independent Living in Topeka. And you can move through those real quick. But these were all guys. Mike Donnelly, who was the director of the Topeka Independent Living Center, was one of our best advocates and really helped pay for a lot of the beginnings of council so that we had a staff person who could be up there all the time. And then for some reason he went to the dark side and went to work for the state agency. And that's when Brownback came into office and a lot of the rules were really kind of tore us all apart. They need to come back together again. We need to bring them back together again. Shannon Jones, I don't know how many of you know, but she was the first director of the statewide Independent Living Council. And again, we created a lot of changes. The Southeast Center had a new Center for Independent Living down in Southeast. And we also had one down in Dodge City that didn't last, but the Parsons is still very active and running. We worked together with the University of Missouri. We did a lot of subcontracting and we came up with funding and keep moving along. Next one. Prairie Independent Living Resource Center got funded in Hutchinson. Now Beyond Barriers, is that what it's called now? Okay. Okay, so we made a lot of progress in a really, really short period of time. And if it sounds like I'm shorter than you thought it was, it is. It's because it is. Any questions about that? There were a whole lot of people involved in that. I don't know how many of you know the history. I think I gave you a thing that talks about castle history and names of people and everything else, so you've got that available to you if you want it. I love history, but I'm not gonna bore you with that now. But, so where do we go from here? Where's the future? Where do we go? I think we have leaders like, when I first started doing this presentation, these young ladies were brand new to the world and just getting started. They've been around for a little while, but Carrie Greenwood has done some incredible things. Carrie and Julia Canellis have done some amazing things around empowerment of young people with disabilities. And if you've never been to the Youth Leadership Forum, you ought to come sometime. It's amazing. I think you came with me for one day. It's an amazing activity, and it's amazing to see the differences that young people get by spending a week in a dorm and being treated like students at Washburn and just learning about empowerment that whole week. It is amazing what gets accomplished. So they're doing some real cool things. Some of you guys know Anthony Frischmeyer. He's a new kind of younger person into the independent living movement who learned a whole lot from his uncle, who was a great advocate at Prairie Independent Living Center. Stephanie Sanford, if you don't know Stephanie, you should meet her and just listen to her about an hour. She'll get you wild up and fired and ready to go. But just some names of people, and you people are all, your names should all be on there too, because things get done when people make differences. And that's what these folks did. They just said, we're going to make a difference. And we know a lot of people may not like what we do, but we're going to make a difference. And when you do, things change for the better, and they change for the positive. And we all wind up winning because things get better for all of us. I can't tell you how much I appreciate when we first hired Angie to be able to have all the independent living center directors have been wonderful in terms of sharing their information, inviting her to participate with you guys on you know, doing reviews and everything that you've done. When we do that, when we all work together, it only helps and it only makes us stronger. And so it's been a really nice relationship. It's hard for me because I'm kind of sitting on the other side and I see two factions and I wish we could figure out how to get them all to join back together. I'm not going to do that. I can't do that. You guys have to do that. But whatever you can do to be stronger and to be more powerful is going to make you stronger and more powerful. And you're going to have differences and they're going to be there, and there's nothing wrong with that. You don't have to all be exactly the same, but you all deserve to have decent funding. You all deserve to have the ability to disagree with powers that be in Topeka. You all have the right to be able to contact your legislators and let them know how you feel about issues. You all have the right to be respected and to remember that we're advocating on behalf of people with disabilities and ourselves. So that's my spiel. Any questions, any comments? It's a quick ride through Topeka or Salina, but a quick ride through independent living in Kansas, but it really just mounted and built and built and built and built on itself. And I hope it continues. And I know it will continue because y'all are still here and y'all are doing great things.
So Kansas, you know, we have disability pockets here. Do you know if other states have some type of disability?
Once we started doing them, many states came to Kansas and spent the week learning how to do a caucus. And the first one I remember, the first one other than us doing it, I remember going to West Virginia, and the West Virginia advocates did a caucus. I remember going to one in Wisconsin, and it turned out that most of the places that had an association of centers picked up on that and wound up copying our caucus, and sometimes making them better than ours, but copy it on our caucus. And I believe does Oklahoma, do they have one? I know Jeff comes to our caucus every year, but I don't know if they have one down there or not.
Sure.
I can't remember, but I know at least those. So yeah, a lot of them picked up on it and joined it. Any other questions? This is that after lunchtime. Okay, thank you so much for letting me holler at you all day and talk with you. Good luck with your work. What you're doing is incredibly important, and I'm so proud to see that y'all are still alive and going strong and fighting for people's rights, because that's what it's all about. And eventually, we're all going to be disabled, whether we are today or not. So it's not only good for you, we're the only minority group that continues to get new members every day. So continue to be out there fighting, and thanks for inviting me, and good luck to all of you. I'll pass these down in case anybody wants to.
Instead of all sided down.
Just-
Well, thanks again, Gina, for sharing your story. It's an amazing look into the history that so many have put a lot of effort into, such as yourself, and we've all benefited from in one way or another. And so it's a challenge to all of us to step up and continue that fight and to advocate in the future. So, but you're not too far away. We know where to find you.
On the golf course, that's.
So, any other questions online? Some great comments here. What amazing story. Great presentation. You still have passion. Lots of great feedback there coming in. So we'll take a few minutes here maybe to get organized. Our next activity is going to be to go through those service definitions. I believe that that you hopefully received over the email or have here in person. I do have a few extra copies if you need them, but I'm going to pause this for now and give me about 5 more minutes here and we'll come back together.